Hello everyone, my name is Akbar Soleimani and this is my case study report for HAP 725 taught by Professor Alemi at George Mason University. In this case study, I will discuss about the performance comparisons of the Inova Mount Vernon Hospital with other hospitals in Inova group except Inova Loudon Hospital by using multiple measures on hip or knee replacement. I collected all data related to this case study from this website, which is provided by the Centers of Medicare and Medicaid. I selected hip or knee surgery and replacement for this case study, and different measures was chosen, like complication after surgery, the patient payment for hip or knee replacement, Medicare spending per beneficiary, and also I selected two more measures for hip knee surgery: unplanned hospital visits or readmission rate and excess readmission rate. I think we all had some limitations for this case study. For instance, all data which you want to work on that is not exist. And also for some years, we have different name for some categories. In this report, I compared Inova Mount Vernon Hospital with three hospitals in Inova Group: Inova Fairfax Hospital, Inova Alexandria Hospital, and Inova Fair Oaks Hospital. The first indicator or measure which I want to talk about it is payment for hip or knee replacement. In four time periods from 2013 to 2019, Mount Vernon Hospital consistently are outside of upper and lower control limits. It means that patients in this hospital paid less compared to other hospitals in Inova Group. The second indicator or measure is Medicare spending per beneficiary. As you can see in this chart, just in 2018 and 2019, Mount Vernon Hospital are between in control limits. The other time periods from 2013 to 2017, all scores are outside the control limits. The next indicator is complication rate after hip or knee surgery, which shows that between 2015 to 2021, Mount Vernon Hospital are outside the control limits, and complication rate was higher compared to other Inova hospitals. Fortunately, after 2016 to 2019, the complication rate was drastically reduced, but still are outside the control limits. The next measure or indicator for performance comparisons is readmission within 30 days of discharge from hospitalization. As you can see in this chart, all readmission rates between 2010 to 2019 for Mount Vernon Hospital are between control limits. The last indicator is excess readmission rate. The excess readmission rate are measured by a ratio calculated by dividing a hospital's predicted rate of readmission for example, hip knee replacement by the expected rate of readmission based on an average hospital with similar patients. As you can see in this slide, between 2010 to 2016, just in 2012 to 2015, the readmission rates for Mount Vernon Hospital are between the control limits. The other years are outside the control limits, and shows that the excess readmission rate in this hospital were less than the other hospitals in Inova Group. And this is a summary for my report. Thank you for your attention.